Morning, everybody. Sue Hitzmann, creator of the Melt Method. Happy Friday. Hey, I'm out here with my cat, just about to go over to the gym, and I checked the post that I did yesterday about the mini softball in the small softball in the hand and foot kit, and I had mentioned, hey, if you guys have specific issues, why don't you let me know here, and tomorrow morning before I get my day going, I'll post something. And one of them was about knee pain. And if anybody knows about knee pain, it's me. When I was in 8th grade, that was the first time I injured my knee. I was playing tag, and this kid, Steve Klee, thanks Steve, as I was jumping over one of those big yellow cones in midair, he pushed me as I was jumping, and I just went flying and landed on my knee. And they ended up, I had water on the knee, like the big fluids, and they drained my knee, and this doctor pushed on my knee and squeezed out all this fluid. And then they put me in a splint, and then 6 weeks later, they were like, go back and play soccer, right? So it was like, okay. And then when I was playing soccer, subsequently, getting kicked in the shin, hyperextending my knee, another splint. And by the time I was 20, I'd be washing my hair and my knee would buckle out from underneath me. And the doctor that I finally went to, I was about 22 years old, and I got an MRI of my knee, and they said, oh, you've got 2 tears in the medial meniscus and a cross tear in the lateral horn, so we're going to remove the meniscus. And I said, I think I'll keep it. And the doctor said, well, you can't keep it. And I was like, well, it's my meniscus. I'm pretty sure I can keep it. And he said to me, if you keep that meniscus the way it is, you'll be crippled by the time you're 30. And I was like, well, that sounds like a threat. And seeing my mom had had surgery when she was younger, and she said it was the worst thing, I was like, I don't want to be like Linda. So I kept my meniscus exactly how it was. And through learning how to do self-care, figuring out where I had imbalances, and a big shout out to Jim and Phil Wharton with AI Stretch, and learning how to reestablish hip stabilization. That was where I actually had my first introduction to neuromuscular therapy, which is really a foundation of what Melt Performance is, and what neurostrength is all about, is improving hip stabilization, shoulder stabilization. It was really what got me out of the chronic state of imbalance, and as I decreased the load on my knee pain was better. Now, some other things about your knee in general. The knee is the largest joint in your body, so it's one of those ones that if you have a poor diet will get loaded with toxins. Anytime you have a space, right, where we have spaces, neck, abdomen, then knee, 3 largest spaces in your body, they tend to be the 3 areas where there's a high tendency toward pain problems. And it's because toxins do love to live in spaces, and connective tissue in the multi-microvascular spaces of fascia is where toxins reside, and then ideally we flush it out through our lymphatic system. But if our lymphatic system is all bogged down from the crappy foods we're eating, and the bad environment, emotional trauma, and all these other things, it can cause a real slowdown. And so our knees are definitely one of those joints that collects a lot of toxins. The other thing is your knee is a forward-moving joint, and so if you're feeling frustrated in your life and you feel like the steps that you're trying to take forward are sketchy, you're not feeling like yourself, again, a lot of emotional issues are tied to knee pain. And I definitely think when I was younger, I had in my 20s a lot of these things building up, and so my knee pain maybe where it was also somewhat related to that. But over the years of melting and knowing how to maintain hip stabilization, I don't have any knee pain, and I can fully flex, I can do squats, I can run, and I would never run previously. So I can tell you, if anybody knows about knee problems, it's me. Now, what can you do using Melt? Well, first of all, you'd want to go fairly basic to begin. And so what would be basic, and what I mean by that is the indirect-before-direct approach of Melt. Like if you have a knee problem and it's ongoing, right? It's not an acute trauma, like you didn't fall and jam your knee. If you fell on your knee right away, you definitely want to take a very indirect before direct approach. So you'd want to start with your feet, then maybe work on your upper back and try to draw fluids down to the legs, then begin to work on the calf, and then slowly approach the knee, right? We don't want to go near areas where we have heat or inflammation in it right away, because you'll just increase the tendency for inflammatory problems. So we want to bring fluid flow from other regions of the body through to the areas that you have pain, especially if it's acute. But if it's something ongoing, you've had chronic knee issues, nothing is resolving it, while doing the foot treatment is wonderful, you'd really want to go more local to the area of the knee joint. So definitely for melt, working on back thigh is really important, and working on your calf and your shin is critical. But depending upon how much you can flex your knee, working on the shin with the roller is sometimes difficult. There's other strategies using the large firm ball on your shin, but working on the shin is actually a really important piece of it. But I wanted to demonstrate a couple of things about working right around the knee that can be really valuable today, just to show you some strategies using the full roller. Now, there's also stuff you can do with the half roller, but I'm going to go ahead and just show you a couple of things with the full roller this morning. So first is inner thigh gliding and shearing. I'm going to make sure that I don't mess up my little mic here. So you're going to take the roller, and you can angle it as far away from your body as you need to get the right angle of your leg. And what you want to do is start where it really looks like the side of your knee is on the roller. So I'm right on the side of my femur right now. So I'm on the boniness of the knee. So if you start perfectly side lying with it here, you're going to get more accentuation right around the cusp of the knee, which is where vastus medialis origin is. And we're also going to work on the front thigh. So we're going to go back and forth between the inner thigh and the front thigh. And the nice thing about working down low is you can pretty much do it down here. So if you fall forward, you kind of slide your body forward, and you just pause for a second, soften your knee, and as you push your body back, you're going to feel like you're pushing your thigh into the curved side of the roller. So as I fall forward, I'm more top of the roller. I push back, I'm more curved side of the roller. So the secret of working around the knee, really anywhere, is keeping your pressure constant. So I don't want to feel like I've got heavy pressure, lighter pressure, heavy pressure, lighter pressure. I want to actively participate in keeping the pressure constant, because the more consistent the pressure is, the less it will hurt you. It'd be the same thing as if you had a bruise and I just kept going poke, 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 right? That would hurt you a lot. But if I just gently compressed it, it might hurt at the beginning, but then if I sat there, it wouldn't hurt as much, right? So consistent pressure is really important for gliding. So what I want you to see here is, as I'm gliding, I'm going to work a little bit more to the front of my thigh just by turning my toes down to the floor, and then I'm going to work back into the inside of my knee. And the inner part of the lower part of the thigh is some area where you really want to try to open up some blood flow and get some fluids moving back to the capsule of the knee. So this is definitely one of these areas I would spend quite a bit of time gliding, maybe 30 to 60 seconds. And then on the pushback, I would pin the skin, and then I would start shearing. And you can do that by keeping your ankle flexed so that you're keeping the knee tracking proper, so that, if you keep your ankle relaxed, it's going to cause rotation in the lower leg, which might cause clicking in the knee. So you keep your foot flexed if you have knee pain. You bend and straighten your knee 3 to 5 times. You can then relax your thigh muscles and just let the leg roll over the roller. Or you pin the skin, and you can even hold on to the roller so it stays still, and you try to twist the flesh. So it's kind of a rolling, but it's a pinning and twisting of the skin. And then you could just wait there for a moment. Give the tissue just a second to adapt. And I don't know if you can see it, but the roller's already moved up from where I started, right? I started with the roller here, right on the side of my knee, and now it's up a little bit. So I could maybe bring it up a touch. I wouldn't go too far. And then you're going to glide again. Only this time, we're going to stay on the inside of the leg, and we're going to get really specific here. So again, I'm going forward. I'm on the top of the roller. I push back. I'm feeling like I'm on the curved side of the roller, right? That's really the secret of getting the actual benefit out of it, is, again, the consistent pressure in how you glide. It's not just ironing yourself like a shirt, like you always see people using foam rollers. Remember, melt is not self-myofascial release. We're trying to improve hydration to the fluid components of fascia. The muscles, like Gil Hadley said to me once, muscles are fascia's bitch. They're going to do anything that the fascia tells it to. So stop thinking you're going to release muscles and that the muscles are the problem. The fascia is the origin of most of the unnecessary tension or compression you're feeling in your body. So again, I'm going to find a spot I want to work on, and I'm going to go ahead and I'm going to do my shearing again, bending and straightening my knee, lifting and lowering it a few times, again, the rolling action or the pinning of the skin. Okay, so now in this area, now we actually are going to go back and forth. So now I was just on my inner thigh, but now what I want to do is come up onto my forearms, and I'm going to look away from the roller. I'm looking away, and I'm lifting up my opposite hip, and look at how I'm going to keep my butt up a little bit, so I'm not hanging down like this. That's a lot of pressure on my low back. I'm going to keep my body up, and I'm going to kind of turn my thigh inward, and then back to center, and then I can kind of shift over, and I can come back to center. And then here I'm going to find that same type of motion. I'm going to bend and straighten, so I got to keep my core engaged, bending and straightening my knee. I can roll my leg in and out, or I could just wiggle my hips left to right to create the pinning of the skin and the shifting. And then same thing, I just kind of let the pressure compress and wait. And then I'm going to come on back down. And you can see that the roller's already up higher in my inner thigh. And I would just repeat the whole thing, and I would just slowly work up the front of my leg, okay? So it's really important that if you have knee pain, you've got to work on the inside. Again, like I would pick that spot, I would do my shearing, I would come up, and then I would find another spot a little bit higher. Again, look at how my hips stay up. And so I'm almost compressing more, again, to the curved side of the roller more than I am the top of the roller. That's really the secret of it, is keeping the pressure more to the curve of the roller. And then same thing, I could do some shearing here. I could do some rolling, I could wiggle my hips back and forth. There's my shear, I wait there, and then I come on and off the roller. Okay, so that's part number one. Now, I would obviously repeat that on the other side, but I would repeat it on the other side, but the other thing that I would also do is I would get that roller on the outside of my knee also. And in this area, if you have any shoulder issues, right, these are like more difficult movements to do because you've got to hold your body up. So if you couldn't do that, we could stay down and I could just move my whole body on the floor. You see, I can just kind of push my body back and forth if I need to, right? So that I don't even have to come up. So I could do some gliding and explore the tissue this way. But if you can come up onto your forearm, you come up on your forearm, you use your top hand, and you want to keep your knee soft. And if you can keep the knee soft as you do your glide here, again, I'm going forward, I'm more top of the roller. As I push back, it's almost like I'm more, again, on the curved side of the roller. And then here again, you see how I'm keeping my knees soft, right? So I'm not locking out my knees, they're staying soft. I lean forward and I get right above my knee. And some of you guys are going to be like, there is a devil living right here on my leg, right? So look at how I could pin the skin and take my legs for a slow walk. I don't want to feel too much tension. So if it's really intense for you, drop the bottom leg down, right? So I could just do the rolling this way if it was too much with both legs. Or I can do what I call my mermaid kick. So it's the cross friction and the little twisting. And then same thing, I would wait there for a second, right? So after I went on the inside, front side, and outside, then I would go down into my calf, and I would just start doing all the calf work, right? And that's how you're going to get the fluids back into the capsule of the knee so that you're actually hydrating it. And same thing, you do gliding, you do the shearing, you could do the flexing and extending of the ankle, the rolling, or the twisting action. And then you'd work down a little bit lower. So those are some of the moves that you have to learn to perfect if you've got knee problems. Then the other things to work on would be hip to heel, press, rotate, and cross. They're lengthening techniques with your hips up onto the roller. And once you've done those things, if you really want to make an impact in your knee problems, you've got to work on the lower body stability sequence from Melt Performance. That's really where the magic happens, is when you start working directly at your hips. Because I can tell you from when my knees were really horrible, my hips were horribly out of balance. My mid-thoracic spine was weak, lower regions of traps were weak. And as I started to utilize the proper stabilization techniques, my knees never bothered me anymore. I got the imbalances out. And the only way that you can learn that is by watching those videos. On Melt On Demand, there's not only sequences, but tutorials on those key techniques. And if you really need extra help, I would search out one of our melt instructors. They're doing Zoom classes all the time now. A lot of them do, one-on-ones through Zoom, and they can really watch you and perfect your techniques along with you. So if you really feel like you need the extra hand, again, there's piles of instructors who can help you out. But that would be my strategy for knee issues. Inner thigh, front thigh first, then outer thigh and calf, then do some of the lengthening techniques, and then start working on hip stability. There are so many melt maps on Melt on Demand. If you just type in knee pain, you're going to see all sorts of different videos that can bring you through those, so that you're not doing an hour of melting. If I did all of it, it would take an hour class. But I could just spot work on it. Work on the compression techniques in the morning, do some lengthening techniques in the afternoon, do some strength work in the evening. But just don't do nothing. The volume of time we spend sitting is causing a lot of havoc in people's hips right now. It's causing a lot of discrepancies in the way that psoas, the communicator that our brain uses to figure out where our spine is in relationship to gravity, is just out of balance at this point. So many people are sitting so much more now. A lot of stress levels are high, so we're kind of losing our forward momentum in our lives. So remember, the knee also is a forward-moving joint, and it needs a stable hip to move well. So those are my tips for the morning. I'm going to do a little bit more on my own, and then I'm going to head over to the gym and do some upper body strength work today. Let me see if any of you guys have any specific questions about what we're talking about here. I hope that this helps you guys. Thanks for watching as well. I've been told I need a knee replacement. My femur is very close to my tibia. There's almost no cartilage. Is there anything I can do to avoid surgery? It really depends upon how bad it is, Yvonne. Like when my knee was really bad, I had torn my meniscus in 3 areas, and they were like, you have to remove it. And I thought, I don't want to remove anything from my body. It's mine. God gave it to me. I'm keeping it. So I worked on it, and I just really every single day did work on it. And I think that the thing is, when we have pain, we work less. We move less because it doesn't feel good. But if you don't move, it's not going to get any better, and in fact, it'll just progressively get worse. So having bone on a knee, if it's so bad that you can't walk downstairs anymore and things like that, sometimes a replacement is the very best thing to do. And depending upon your age, getting a joint replacement isn't the worst thing on the planet, and in fact, it can sometimes improve your life. So it really just depends upon how bad it is. But if you feel like you're trying to preserve it and you want to see if you can minimize the pain and get your joint moving better, I would do what I just told you. It's not going to get better with hope. It doesn't get better because you watch me do it. You've got to do the work. And that's my suggestion, is everything I've said here. Go back at the beginning and watch this thing through again and get yourself into a place where you're really taking the time to do the self-care. It's a daily self-care practice. Self-care is a discipline. I don't know. I don't think it doesn't come easy. You just have to be willing to do it, and do it every day. I melt every single day. I meditate. I do something for myself every single day, because I think that my life is worth some self-care. And I think we all need to practice it. And if you have a daily self-care practice, it is easier. And that's the fun thing about Melt on Demand, is you could literally every single day just click on one melt map and do a melt map every day. And there's enough melt maps already on Melt on Demand. By the time you get to the middle of next year, you'll get through the end of next year, and you'll have 365 maps to do. There's already over 200 maps on the app, and I put out a new video every single week for you guys in pain, performance, and lifestyle, joint problems, sleep issues, digestive stuff. Anything that you have an issue with, there's a melt map for it for sure. So that's my 2 cents on, do you need a knee replacement? I don't know. I would have to look at it. I can't really tell you. Let's see if there's any other things you guys are asking me today. That's the only question I see. So listen, I hope you guys are having an awesome day today. Remember, sip water frequently. Eat water-filled food. Stay away from dairy. Stay away from soy. Stay away from all of the, crappy foods that are in boxes and in wrappers. Try to get some real food into your diet. Eat some vegetables today. If you haven't had any vegetables this morning, how about making a shake and putting a big handful of spinach in there? You can disguise vegetables and things. My friends who don't like vegetables, I don't know, it's like saying I don't like air, right? People say, oh, I don't like to sip water because it'll make me pee more. That's because you don't sip water frequently enough. Do you know if you sip water frequently, you'll pee more volume less times in a day, and you'll feel better. So sip water frequently. Don't be afraid of water. And listen, go tell at least 2 people today for me. 2. For me. Go tell 2 people, I love you, you're important to me, and I appreciate you, because putting that positive vibe out in the world, I think, really goes a long way, especially with all of the chaos going on in our world today. So I hope you all have an awesome day. Happy melting. Hey, Baron. Hey, you. You're awesome. I love you. I think you're amazing. I've got 1 down for the day. I love you guys too. Stay with it. Happy melting.